My name is Diana Copeland, and I'm the Senior Communications Officer at White Ribbon Alliance. I'm going to be helping to facilitate this event and really excited to share about the What Women Want dashboard. Joining me on this call, we're actually going to have Angela and Angel from White Ribbon Alliance Kenya. So I'll have them introduce themselves in just a bit. But then we're excited to hear any questions you'd have about the dashboard. Angela gave an incredible presentation just now. Love to hear your thoughts. Thanks so much for sharing your information, your name. Would love to know if anyone has any questions specifically about the dashboard or the What Women Want campaign. Love to talk to you about this. Perhaps to get us started, we can just start talking about the dashboard. Angel is online too. Angel, if you wanted to introduce yourself before we got started, and then we'll have Caroline go through the presentation and we can just share a little bit as we go.
Hi everyone, my name is Angel Katusia from White Ribbon Alliance based in Nairobi, Kenya, and I lead communication for White Ribbon Alliance in Kenya. And I'll be taking you through the dashboard, which is such an exciting tool that you'll be able to see as we go on. Thank you for joining us.
Thank you. Caroline, could you go to the next slide? So as Angela was speaking earlier, the What Women Want campaign took over the world. We were in 114 countries and were able to ask a single open-ended question. We found so much power in this open-ended question and also the fact that there was only one. We'll go to the next slide.
The goal of the What Women Want campaign has always been to provide policymakers and advocates knowledge and insights into women's health demands in their own words. It is very critical to always have a pool of information that can be brought together and analyzed to discern patterns and make better decisions. And that's what Angela really spoke about, the What Women Want. We sought to hear from women themselves, women and girls, so that we can have information which is key to shaping new and existing advocacy projects. The dashboard that we're going to take you through, if you're going to be here with us, is going to assist advocates and other stakeholders to improve decision making and always unearth valuable insights about women and girls that would otherwise remain very hidden. The dashboard will also strategically assist donors and partners to support projects that align with what women and girls really want when it comes to reproductive health needs. This information in the dashboard is actually raw asks from women and girls. How they said it, how they want it is how they said it, and the dashboard gives you an opportunity to explore and see how girls from the 114 countries really said they want.
Next slide.
I think the voices of women will also ensure that project designers and implementers design projects that have the priorities of women and girls at hand, the dashboard will also be a source of real voices for women and girls for media. Media has been thirsty for information for so long about what really women and girls want when it comes to health, reproductive matters. And I think this dashboard, when you dive deeper into it, you're going to get voices from all over the world, from Mexico to Nigeria to Kenya. And you can also get voices of women in different age ranges. That will be, whether you want what girls between 18 and 21 said, 30 years said, you'll be able to explore that data. So I think this information is going to be key for stakeholders in the health sector, outside the health sector, in the private sector, just to give them a light on what women and girls really say they want when it comes to reproductive health care.
Next slide. So why a dashboard? We've been asked that many times. The goal of the campaign has always been complete openness, and the women and girls who participated wanted their voices to be heard, their thoughts, opinions, and demands to be taken into account when policies were being made that would impact them directly. We heard it a lot. So we thought a lot about the best way to share this information with the world. We thought maybe releasing a Dropbox folder of responses on hundreds of Excel spreadsheets filled with 10,000 responses per page could have been one way. But we asked ourselves, is that useful or even usable for anybody? So a dashboard, this dashboard that we created, was the only way that we could ensure that women's demands could be shared openly in a really user-friendly way, while still protecting an individual respondent's privacy, so that anyone, anywhere could have access to this incredible repository of demands, and also to use it to advocate for the kind of change women themselves are asking for. Next slide. So how did we actually do it? This was an immense in-person people-powered mobilization campaign. Hundreds of mobilizers and volunteers took part and dedicated their time to going into every possible community that they could find to ask every woman there this one question. So it was an incredible, this campaign, and the way that I look at this dashboard is that it is a combination of people-powered, just like chutzpah, and a technical expertise that is able to basically categorize a million answers to an open-ended question and make it usable. So using the original campaign from India, where it started, we refined categories for a global frame. We initially had about 50 categories that were related to key areas identified for improved outcomes in maternal and reproductive health. But very quickly, we saw that women's and girls' answers were taking us well beyond that. So mobilizers would send in suggestions for new categories as they heard from women. Other categories were created or consolidated based on volume and recommendations from technical and country experts. And then a core group of reproductive and maternal health and rights experts from White Ribbon Alliance refined the codes even further and hand-coded approximately 800,000, or 70% of the responses, often sitting together and discussing women's and girls' answers to ensure that everyone was categorizing responses in the same way. The remaining 30% or so of the 1.2 million responses were coded with the help of a data engineer who used Google's pre-trained BERT model and fine-tuned it as a text classifier, which resulted in a micro average precision recall score of 83.9%, which is very good. We realized that there's probably a lot of questions about the technical aspects, and we're so happy to always answer that. But the basic parts of this is this dashboard is the result of a combination of this people-powered hand coding and cutting-edge natural language processing technology and machine learning techniques. Taken all together, it means that over 1 million responses feel tangible, as well as understandable and usable for advocacy purposes. And it wasn't easy, and we were breaking new ground in many ways through this work with the technology that we were using and how we were using it. We were able to push through when it often felt impossible because a million's a huge number, but it's important, and because we promised the women and girls that their voices would be heard. Next slide. Well, now we're actually going to be able to share the dashboard with you. I'm sure you have many questions. Angel's going to start us off, and Caroline's going to navigate us through this dashboard.
So when you get into the site of the dashboard, the first thing that you're going to see is you can start with finding out more about the What Women Want campaign that Angela spoke about. When you click on that link, you'll be able to find it. You can also watch an overview video of the What Women Want campaign, and you can also activate a step-by-step tutorial to take you through the dashboard. It's a very easy to use tool, and I believe each and every one of you should find time to just scroll and dive deeper into the dashboard to be able to explore what it offers. The first step in using this dashboard is to go to the section in the upper left that features the filter tools. Within this section, you'll see two tabs. One allows you to drill down to get more specific information on responses by country, category, age, and even keyword. You can find Kenya, Uganda, Tanzania, Mexico, Nigeria, Malawi, India. You can also find, different categories, different age groups, and whatever you'll be able to filter is what will appear on the above side of your left hand. One allows you to drill down to get more specific information on responses. And I want us to do a very clear example by choosing Kenya at least, so that we can give you a clear example of what we're talking about. The other tab allows you to compare two countries or two responses. This can especially be useful when you're attempting to contrast the responses from countries or to find similarities and differences between various age ranges. Let's choose Nigeria, at least to show you how you can compare between Kenya and Nigeria for now. The upper right of the dashboard shows you the number of women who responded either in total or for the specific filter you have selected, and a histogram of the ages. Now you can see women in Kenya, women in Nigeria, and the average age that you've selected.
And so across the entire campaign, we were able to hear from women and girls from 114 countries, but most responses came from areas where White Ribbon Alliance works and where we were able to mobilize our extensive networks of supporters and advocates. So the dashboard only highlights responses from countries that collected a significant amount of demands, about 10,000 or more.
Immediately to the right of the category bar graph is a box that shows you a sample of 1,000 responses. The responses reflect the category you have filtered for, and the sample is changed every time you refresh the page. This reflects the demands for openness, and the desire to be listed is at the heart of What Women Want campaign, and the dashboard lets you see exactly what women said and how they said it, whether it was through one phrase word, two phrase word, or three phrase word. So we'll choose an example. So allow us to check into an example where we'll go into a single word phrase. Let's say we wanted to take a deeper look into women's demand in Kenya for respectful and dignified care. So we had already chosen Kenya. As we look at the top single word phrase, rising to the top is doctor, respect, woman. This might give you a general idea of what women were asking for, but let's click into the three-word phrase so that you can just see how women defined different things. Just look at the responses and you see abusive language, good communication skills, use of polite language popping up. Women and girls are really fed up of being treated poorly at health facilities. They wanted to be spoken to with kindness and respect. And when you dive deeper into the three-word phrases, you'll be able to see the exact words that women use to define what respect really meant to them.
Down here as well, you'll also see the map. So right now, Kenya is highlighted, but you can click on a different country and you'll be able to change all of the information to that. So maybe click on India, Caroline. It now reboots the system and we're looking at Indian responses. We can go to the top and let's drill down even perhaps a little bit deeper, but also please feel free to put any questions into the chat so we can navigate along with you.
You've seen how when selecting a country, the dashboard will filter and show only responses from that country. But you can also select multiple countries to look at a response from an entire region. If we add Uganda and Tanzania into Kenya, we'll be able to see the East Africa region. This selection process can also be done with age, response topics, and keywords. So you can fill in different response topics, keywords for you to be able to see a region, how they responded to different issues. If we wanted, for example, to see how many Kenyan women aged 20 to 30 demands related to water, sanitation, and hygiene, we can set those parameters within our filters. And I know Angela really spoke about WASH in Kenya during her talk in the previous concluded session. So you will see the dashboard is now filtered only to those responses that were targeted to WASH in Kenya for women aged 20 to 30. We can drill down even further by searching within this category for the keyword water, and we'll only be seeing the times water was used within the WASH code. But you can also exclude words when you look at it. If we exclude drinking on water, now the dashboard is only showing us water in context used outside drinking. You can see what women were requesting when it came to having access to water for washing or bathing. I know cleanliness is a huge policy issue right now because of the ongoing COVID-19 crisis, washing hands and all that. So another example we can try is looking into clean, so that we can just give you guys more examples. We're going to clear the term function and replace water with clean to see how the dashboard changes. We can now exclude water to see responses that just had to do with basic cleanness and not the request for water, like clean toilets, clean facilities, clean delivery beds, like that. You can also be able to see that.
Yeah, I think it's really obvious by looking at this dashboard that women and girls are tired of receiving care in dirty health facilities. They urgently want cleanliness throughout the wider environment, ranging from the labor rooms to hospital beds, like Angel said. And globally, this desire for cleanliness actually accounted for 65% of women's total WASH demands globally within this campaign. And it's really telling and shows us there's a huge problem with cleanliness. And I don't think it's a coincidence because environmental cleanliness is widely ignored and not prioritized on a policy level on the whole. But now as an advocate for women and girls, you could actually use this dashboard to help make the case for the importance of investing in environmental cleanliness in health facilities, not just globally, but also nationally and at local levels too.
If we look into an example of how White Ribbon Alliance Kenya, and that's where I'm based, is advocating for water using this data, is like in some counties where we are implementing a universal health coverage project, we have empowered Kenyan women and girls living with disabilities with knowledge and information to advocate for change at their local health facilities by having conversations with the facility management to ensure that the delivery of care meets quality standards, including increased cleanness, water, and sanitation. We know, like now with the COVID situation in the country, we are responding to most crises that we were not ready for. For example, what we are doing in a county called Kajiado, which is our arid county in our community, we had to respond to what women and girls in that county requested. They requested for sanitary towel kits because women and girls defined those as dignified care for them. And therefore, we have moved to respond to these needs during crisis. And it means that this data can prepare you to respond to urgent needs, future needs, or even to tailor your own existing advocacy projects for you to be able to amend them to what women and girls are asking for.
And we also know, this is a strategy that works. Recently, the Niger state government in Nigeria made a policy commitment wherein focal primary healthcare facilities in the state needed to increase the number of clean, working, functional toilets from 3 to 6. It's doubled. And this policy action happened because WASH was the #1 What Women Want request from women and girls in that state. And leaders are listening to women and acting on their demands.
And we know information is very important, and the information has been laid down for you. Everybody anywhere can access this dashboard. Who knows what else is possible and what other life-changing policy decisions will be made because women's voices were actually listened to and because their own words were actually seen. The dashboard allows everyone, everywhere, the chance to examine what Women Want campaign's responses at a unique level of detail, a first for transparency in the nonprofit sector, and that we hope to see replicated in other organizations, campaigns, and initiatives. Thank you, everyone, for joining us, and we are happy to take questions. We'll be able to take them from the chat and respond to any question that you have, but it will be really amazing if you could dive deeper into the dashboard and explore what it can do for you no matter which sector you are in.
Hi, Diana Angel. This is Christy from WRA. That was a really great presentation, and I appreciate how often how you simplify this and make it so easy to understand and use. It'd be really great to hear a little bit from Angela and Arpajita in Kenya and India. I think they're both on this call about how they've been really hoping to use this to employ it, and how to like being able to really kind of accelerate and make change, and what you think of might be any opportunities to get decision makers even to directly use it.
Hi, Christy. This is Angela and everyone else on this call. I think for me, as I said earlier during my presentation, for me, the dashboard basically presents the voices of the women and girls. And so looking at how we're going to use the dashboard here in Kenya, it's basically selling it so that people can hear themselves. I have used the word selling because it's like making people aware about it so that they can hear for themselves. It's very easy for people to say, that is information that is coming from you as a movement. We want people to see the realities, the truth of what women and girls are asking for in their own words, in their raw ways. So it's all about ensuring that those who use the dashboard get to understand that this is not Angela speaking or White Ribbon Alliance in Kenya speaking or our partners speaking. It is the women and girls that are speaking out the issues or the things that really matter to them. And as such, I think when you hear words from the horse's mouth, it's easier for you to act based on that than hearing it from a second or third party. So for me, it's about ensuring that this dashboard gets to anyone who really cares about MNH and the broader, because it's not just MNH, but the broader gender agenda and other sectors that are coming on board. Who cares about women and their needs and communities and their needs? To basically look critically, use the data insight to really shape policies and programs and practice and changing of practice and how and ideologies. Basically, there's so much that needs to change as a result of what women and girls told us at the What Women Want campaign. So for me, I look at it as such a resource, because it's going to really lay bare what are those issues, not hearing it as packaged by an organization, but laying it bare as what women and girls have really said. Thank you.
Well, thank you for that, Angela. And I think I echo everything that you have said. And, I think the dashboard is a really important milestone for the entire family, which were working on What Women Want campaign. Initially when we started, it was just getting the voices, it was just getting women to talk about what they want. And then it was, looking at the data, really understanding what women are asking for. And then, dividing up all the asks as per, the target that we would like to put the ask in front of. So it was not just analyzing the data by region, by national, by countries, but also figuring out what message can we take to which particular policy maker or which particular ministry or which particular minister. And I think from your presentation earlier today, Angela, we know that in many, many countries, the voices of women have led to policy changes, have led to allocation of budgets, have led to, respectful maternity care, for example, emerging as a priority for policies in countries like India. And I know that respectful maternity care was pushed by the What Women Want findings in at least 6 countries. And now coming to the dashboard, I think it's really, really important that the data is in one place. And I think for people who have been part of the campaign, for people who's not been part of the campaign, I think the dashboard is an extremely important tool where you can see and really understand what women have asked for. I think it's a tool. It's a set of information which will really help us, kind of push what women is asking for to the correct audiences. And I saw somebody had typed in the chat box about how can this dashboard be used locally. And I think local has different definitions. If you mean local by people in the country, I think we can go down, look at a drop down of a country, etc. We can do that, but I feel that we still have to be creative in order to take this data back via the dashboard and via other advocacy campaigns to the women who actually spoke out. So I feel that we still have that last mile to cover of ensuring that we use data, we use the dashboard, we use our networks, we use our champions to ensure that progress is made on what women have asked for. Thank you.
It looks like there's another question in the chat box. Very specifically, if one wants to use an aspect in a study, how can one cite the information? Diana, do you want to take that on?
Sure. Actually, I can put it in the chat. I'm going to put it right here. I think this is probably the best way. We're actually going to update our frequently asked questions, which is on the website, to include this information as well. But I put it in, so we think this would be the best way to use it if you're citing it at this moment.
Yeah, and Diana, I know when you're sharing screen, it can be hard to follow the chat questions. Did you want me to kind of read you all the chat questions that are coming in?
Oh, that would be fantastic. Thank you, Christy.
Great. And then I think the desire is just to have a conversation, and people should also feel free to ask the questions verbally as well. Sandra, actually looks like you are just was answering a question from an Anna Lois. Do you want to share with everyone?
Hi, sure. Can you hear me?
Clear as a bell.
Okay, nice. Thank you. Hi, everyone. And thank you so much for letting me speak. My name is Sandra Moranya. I work with White Ribbon Alliance in Kenya. And I was just responding to the question by Anna Lois, which is a very critical question because at the end of the day, when we do have these responses, when we do have these insights, we'd like to know how does this look like in practice. And so what I was saying is in Kenya, we were able to then focus on the priorities that showed up, right? And our top demands are respectful care, menstrual health, WASH, and even increased and better supported midwives. And so what we're doing now is we have transformed these key top demands into action agendas, which then we use for programming. So for instance, with the increased and better supported midwives, we use the dashboard. So again, we always come back to the dashboard because that's where the real raw voices are. And so we were able to then determine what did the women and girls truly say in Kenya? What did they truly say about what better supported midwives look like? What do you mean by more midwives or more competent midwives? And that is the information that we've used to design the current work that we're doing, where we are now not only going to work with the women and girls in Kenya to actualize this need and demand, but also bringing the midwives into the picture and truly connecting the perspectives and the agency. I hope that helps.
Great, thanks so much. I actually have a question that I would love to pose and just see what others think about it on the call. You know, we've talked a lot in the other sessions. Nisha wrote this in the chat box. I noticed that was about sort of following the data and the importance of, you know, following the data, which, you know, I wholeheartedly agree with. But I'm often curious, what is the data and the evidence that shows that is ultimately what persuades people and how that influences their decision making? Because so much is done without data. And again, just the power of demands and voice and thinking about that even as data and how that can really be sort of a tipping point in scale. It'd be really interesting just to hear from some of the different individuals about their experiences of persuading decision makers to act, you know, from a purely evidentiary standpoint, from a citizen voice will standpoint, to sort of a combination of all of those sort of things together, and what's been working and what's been really effective. And potentially be really great to hear how people have used this or not to augment that, you know, the traditional type of evidence and data that comes more from implementation science or academic institutions. I don't know if anyone has any sort of experiences they would like to share or speak to that from Kenya, you know, Angela or Sandra or Angel, or Arpachita in India. Mary, would also actually, I wonder what you kind of thought about this. Mary, I know you're on the call, hate to put you on the spot, but curious if you have any reactions or thoughts on that question. See if somebody comes off mute. Yeah, Mary, is that okay? Mary, if you had just kind of reactions or thoughts?
Can you repeat the question, please? Sorry, I was just dealing with my kids.
Oh, sure. No, I totally understand that. And yeah, just we talked a lot about following the data. And I often wonder though, what is the data and what is the evidence that shows that's ultimately what persuades? And that is really how, you know, we talk about evidence for decision making, but often is that really what is the tipping point and helps decision makers make decisions? And how do we combine that like effectively with sort of a new thought or approach about data that also includes sort of citizen demand and women's voices? And just if anyone has any anecdotes or experiences in sort of successfully marrying those things and how that's helped to really maybe accelerate action or wins. Thoughts about the data on, is that really is what really does persuade decision makers?
Yeah, no, it's a great point. Money, I think, is a big one. But I think it helps. This kind of information, from what I can see of it, would really help inform our advocacy strategy. For example, as I kind of saw just in that first part of the presentation, you know, clearly WASH is a clear issue for some countries. So ensuring that we're partnering with various groups that are working on WASH, or if it's respectful care, you know, ensuring we're partnering well with the professional associations on their in-service and pre-service trainings. So I think this information is really informative for our own strategic planning for advocacy and promotion. I think that's how I would be using this data. And I think, you know, you can use the data for policymakers. It depends on which policymakers you're trying to target at what level. And, you know, I do think a lot of decisions are made based on kind of the cost effectiveness and economic gains, at least from, you know, when you're looking at kind of higher level policymakers, or even from district levels. You know, they need to be able to understand what they can budget. So I also would wonder, you know, how you kind of marry those two. So that's just my own experience in terms of being able to use this data for action. I don't know if others can comment on that as well. Thanks for engaging, Christy.
Yeah, thanks, Mary. I appreciate it. Terrific. And Angela or Aprijita, thoughts or reactions on that?
Hi, Christy. Christy, this is Aprajita. I can come in.
Great. Thanks, Aprijita.
You know, policy making in many, many different countries is a strange process, extremely unpredictable. We can count policies which were made without taking into account any white papers, any data, any evidence, right? And on the other hand, there are policies which are really kind of evidence-based. So, so like I was saying that, policies can change because a particular person in an important position decides something is important. It could be driven very, very narrowly driven by certain agendas. It could be driven by political party agendas. I mean, you for example, you look at, the ban, if you look at the history of, let's say, legalization of abortion, and you would see that how in different point in time it has been so contextual, it has been sometimes so individualistic. So what I'm trying to say is really, really difficult to map out, okay, this is how policies change in every context. So I think what one has to be very cognizant about is what would work in the context of that particular change that you are working on. And we have seen that, besides data, when you have a collective voice asking for the same thing, that really makes a difference. And collective voice could be the media highlighting some of those issues. It could be professional associations asking for it. It could be certain parliamentarians, or it could be something like the What Women Want campaign. So I think what really matters is that one has to be really, really smart about how you are really marrying or packaging your evidence, your data, your human interest stories, and you're putting forward your ask. So I think very, very vital is knowing how to package the ask. And I personally, I believe that you cannot tell a story without evidence and without data. And I think the data that we have, which truly reflects women's voices, and I think this is extremely, extremely powerful in asking for policy changes which are based on what millions and thousands of women have asked for. Over.
Great. Thanks so much. Susan Stassi, you've had some active comments in the chat box and talked a bit about the potential for utilizing this to kind of inform efforts in Uganda.
Yes.
What might you really want to know from the dashboard?
First of all, I really commend you on this effort. My gosh, it's extraordinary. We're doing data collection in much smaller version in the areas that we work, and we are working in the rural areas. And yes, those questions, what women want, those are absolutely top concerns of what we hear on a daily basis. I'm just back and forth with my colleague in Uganda, my program director, and asking her, okay, so about the midwives and the treatment of the mothers that are in delivery, why are they so cruel in treatment of the women? And she was saying that it's because they're so depressed because of the little that they make, and they're government employees. And so here we go. This is through the budgets, through the Ministry of Health. And so the data that you've collected, I can see where this will be very powerful in working towards policy change. But that's what I was just saying to Aparajita, that absolutely the truth that we need to have the data to support our efforts in creating or making policy change. And I just commend you on going through this effort. I know what it's like to transcribe from written results. And like I say, we're doing this in a much smaller scale. However, every response is so important. And so I've been really enjoying listening to the fact that we are not alone, and that Jeff, in the closing remarks from Bill Gates Foundation, basically we all have a part in making change, and so together we can. So it's not an easy charter that we are facing, but I believe that this is a great start. So anyway, that's my comments.
No, thank you so much for that. And that was really helpful. And just it triggered some things in my mind to share with this wider group. It was a lot of late nights and a lot of work, but the richness is quite compelling. And you raised that issue about, okay, what are the connections between issues and how it's happening? Like, we were able to really dig in on the respectful care work, and then see it really for women meant the interpersonal relationship with providers. So then kind of also, it was really interesting when you compared midwifery and respectful care. What was coming up was that was many women's one of their top requests as well, but they wanted more midwives, and they wanted them to be more respectful to them, but recognizing that actually overstretched midwifery was one of the real reasons why this was happening. We are moving forward now with a secondary What We Want effort, where we'll actually be asking what midwives want. That will be coming in the next quarter. And as that information comes up, that will also be integrated into the dashboard. And so you will now be able to click on subsequent questions that have been asked with all of those live responses, and it will happen more in real time. We're really excited. We're working with PregHealth and MSD for Mothers to actually be able to do developing sort of a digital technology that allows us to ask the question, do the real-time analysis and feedback, and upload. So this information is at people's fingertips and real time. And so we'll be piloting that technology through the What Midwives Want initiative. So wanting to let everybody know that that's coming in the next few months, and being able to really, again, see this database of women's demands continuing to expand on different aspects of their interests and issues. Anna Lois, you have your hand up. Do you want to chime in?
Yes, I'd like to just thank you so much for allowing me to speak. I have a lot of questions. I'm sure that you have so many students like me that have got a lot of questions, but I'm very thankful for the program where you actually decided to find out what women want. And with my thesis also, I just found so many things coming across where there was a need for respectful care, which is something that I see is coming through from all your results here in Africa. I'm in Namibia currently. But I really wanted to just ask about how to mobilize things at the ground level. I am a midwife at the ground level, and I've seen that most of the information that comes from research only is seen there at the top, the management and the researchers, the lecturers, but it never really comes down to us, the real people that are there dealing with the patients. This is how, even when there's so much information and policies coming through, they are not implemented because the people that are at the ground are not receiving this information. This is why I kept asking on the previous section and on this section, how do we get this information across to the midwives that are working with these mothers that are saying they need respectful care, they need to be heard, because there's a need to mobilize not just the policies, but to be able to go to the ground and talk to these midwives, teach them, implement all the policies that have been seen worldwide. So that's what I'm passionate about right now. I'm so driven. I'm happy that you started the Midwifery Initiative, where you ask, what do midwives want? Because it's a voice that is also not being heard. Every blame is on the nurse, which is why they're always so defensive at the end of the day. So I've got so many things to say, but I think you hear what I'm saying. Thank you.
Great, thank you so much, Annalise. And I know Angela has her hands up. So Angela, you might actually have some reaction to that as an advocate and midwife yourself.
Thank you, Christian. Thank you, everyone. And Lois, I think I totally concur with you. And I don't feel like whatever you're experiencing is only unique to your region or where you're working. This is something that I personally have seen it across the different countries that I've worked in as a midwife, as a development worker, but also now as an advocate for mothers. And it's something that I've heard and I hear almost on a daily basis from the places where we work. A very good example, I'll say, it's about the COVID guidelines for MNH, for example, that were disseminated in my country. They never reached the frontline midwives. When we speak to midwives from the different countries, they have not reached there. And I think for me now, it's a whole point of why we are really pushing for changes. And I think I want to use Jeff's words around acknowledging, and not just acknowledging, but acknowledging that we have a problem. I think I'll change his words to mean different things. Acknowledging that we have a problem, acknowledging the way we've done things in the past have not worked, but acknowledging that the high level decision making has not really gone down to where the action is, and that's where the frontliners are, who are midwives like you and me. And that is why at White Ribbon Alliance we are very passionate about ensuring that we have the voice of the clan at the start. We have the voice of the frontliner, the midwife, and I think that's what my colleague Christy talked about, and I referred to in my discussion earlier around the what midwives want. We realize a lot of the things that have been spoken about by the client, and that's the mother and the girl. It's a what in the What Women Want campaign was about the health system, about the front line where most of these people seek care. 80% of our population seek care in the lower level health facilities, but those health workers never get to speak up, never get to dictate or to determine how care needs to look like. Even those who make decisions are people or are midwives or nurses or doctors at the higher level policy making position. And so for us, we are looking at an intersection where we can be able to move from the mother to the health system, the front line where the action is, and to the policy makers. So looking at the connection between, and that's why we really believe in the feedback loop as White Ribbon Alliance. How do we connect? And I think at this moment, I'll call most of everyone on the front line to really join our movement, because that is where we'll be able to connect the dots between the client, the user, between the frontline health worker, from the What Women Want, from What Midwives Want survey, to the decision makers, because that is the only way, and vice versa, because a lot of times we've kept on saying data is only at the top level decision making. When is that disseminated? We are told there's no money for dissemination. Then why are you making policies? Why are you changing programs if you cannot really reach that person? So for me, it's about now moving the way we speak or our advocacy, not just to the client alone, but also to the health facility, to the subnational level, to the different levels until it gets to the higher level decision making, and vice versa. I believe that is the only way we can be able to bring around and align change. Thank you.
Thanks so much, Angela. That was really helpful. We actually want to extend the invite to everyone on the call. Are there specific things you want to actually do a quick asking of the dashboard about? Are there specific areas of interest or countries where you would like us to do a quick demonstration and we can show you the content and the results? If anyone has a request of the dashboard, please take a moment and put the question into the chat box, and we can do that quick demonstration one more time. Yeah. The other thing we want to make available to all, if you're interested in doing a demonstration yourself to key decision makers or key partners in the context within which you work, let us know that. And we're more than happy to kind of support you in that regard, in that way to do it. Great. Thank you so much, Michelle. Just noticed your comment in the chat box about the International Childbirth Initiative and translating some of the data into framework for facility level implementation. That's great. Do you want to share a bit more about that initiative and effort and how you feel this could be supportive or we could be supportive of your effort?
Hi, yes, thank you. Yes, well, ICI, White Ribbon Alliance is one of our partners, so I wanted to acknowledge one of the founding partners. It's also a partnership between the professional societies, ICM, IPA, and FIGO. And we're actively recruiting facilities, and we're really looking to make those links between the data and the policies and action on the ground. So I'm happy to talk to anyone offline who wants more information, but we're really very grateful for the data that's being provided by the What Women Want work. And we've been citing it in every presentation we've been giving to promote the reasons for why, this implementation is really needed. But also that we really need to try to figure out how to develop a framework for implementation. Just as everyone is saying, it's very difficult to make that connection, that we're trying to close that gap.
No, thank you for that. And I think it's a good point. And one thing I also wanted to just let everyone know, with the new digital technology, our goal is to drill down even further in terms of demographic information, where this is fairly high level in country, but actually moving more to facility catchment areas as well, which I think can also be really valuable for making that change as close to women and girls as possible. One thing we heard a lot when we were doing a lot of the asking of this campaign was we've heard that, you've been here before asking these questions, nothing ever changes, nothing ever happens. And one thing we think is really critical for What Women Want, and a movement, and even how we think about what matters and what's winning, there's a lot of emphasis on policy changes, but these are changes that women and girls don't necessarily feel or experience in real time or in their backyard. And so there's been a really concentrated effort in this, as an opportunity to do more to push those changes on the local level that women and girls can actually see. So wanted to raise a key point. Sounds like someone might want to come in, potentially a little one. Feel like I hear the joys of a happy baby. Great.
That was my pocket dialing the unmute button.
Okay. Kim, do you want to chime in on anything?
Sure. I think just to your last point about seeing changes show up at the facilities, I think just one anecdote that I'd love to share from Malawi in particular that ties a couple threads together is we've actually heard examples of midwives who have found the What Women Want information and results in their country and use that to advocate for changes at their local facility, including installation of curtains in a particular district. So I think there were some questions earlier about how to make this meaningful locally, and we're seeing some uptake of that from those who participated in the campaign. Over.
And Zach concurs. Terrific. We have about 5 minutes left. So want to see if there are any other sort of questions or comments, and before we close, and hand it back over to you, Diana and Angel, if you also want to make any sort of last minute comments and questions, and your thoughts about where to go next with the dashboard.
Thanks so much, Christy. Yeah, really, anyone on the call should feel free to reach out to me directly, and Angel as well. If you'd like to have more hands-on experience with the dashboard, we'd love to run it through with you. There's so many ways to use this. I shared in the chat as well that there's the on-screen tutorial that will take you step by step, and also a video tutorial. So you should feel free to explore it and see how it works for you, and then reach out, because we're really excited about using this dashboard for advocacy. And we know there's so many incredible advocates on here who can use it, and we want to make sure that you're using it in the best possible way. That's really going to push your own agendas forward.
I think the tutorials will really help people dive deeper into the dashboard. And we've just been able to just show you, a very brief example. So if you have time, please go through. You can imagine over 1 million responses are in this dashboard from different countries, different age groups. So please dive deeper into it. The tutorial will guide you step by step. And yes, if you need anything that you cannot see from it and you think we can be of help, will be available to take you through. Even if you have a session that you're taking people through and you're not very clear about anything, we'll be available to take you through. But dive deeper into it. Explore what women and girls said from different ages, from different countries, and even look at the categorizations, and they'll be able to really help you. And I believe this can be used by those in the health sector, outside the health sector, media, and everybody, even those who are in school, as we've heard from one of us here.
Great, thanks. Arpajita or Angela, any last words from your end?
Nothing much, Christy, except for the fact that we would like to kind of, ask people to support, talking about the data that's in the dashboard, and, kind of let as many people know that there is this resource available now. Thank you, everyone.
Great. And it looks like Angela fell off. So again, just thank you everyone for the work that has gone into What Women Want to Date. And thank you to everyone who is really interested and passionate about delivering on What Women Want and integrating sort of their ask into your broader work. Please let us know how we can be helpful in that regard, because we want What Women Want to be everyone's agenda. What Women Want's agenda has to become all of our agendas to really make the change. So thank you so much, and do not hesitate to reach out, and have a wonderful day wherever you are in the world.
Thank you for joining us.
Thank you.
Thank you, Christy. Awesome.
Bye, everyone.
Yeah, thank you. Bye-bye.